I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, headaches are something nearly everyone has dealt with at some point. It might be small and last only a few minutes, or they could be severe migraines that debilitate a person for several days. And sometimes severe headaches can be a sign of a more serious problem with your body. Our guest today is Dr. Jamie Johannes. She is a family physician at Mayo Clinic Health Systems. Dr. Johannes, thanks for joining us today.
Glad to be here.
Well, let's start out with the basics. I'm sure everyone watching this has had a headache at one time or another. Can you begin by explaining what exactly a headache is?
Sure. A headache is pain in any region of the head. It can occur on one side or both sides. It can range from having a throbbing sensation, sharp or a dull pain. It may come on suddenly, or it may gradually come on as far as the pain goes. It can last for less than an hour, and it can range up to several days.
So I guess the number one question people are going to have is, what causes headaches? And I'm guessing that there are probably lots of causes.
Right. So there are a lot of causes of headaches. We generally break them down into two categories. One is your primary headache, and one is your secondary headache. Primary headaches, there's no underlying disease or cause of the headache that we can pinpoint. Generally, the headache would be coming from an overactivity of the pain-sensitive structures in the head. Can also be induced with different hormone imbalances or chemical imbalances in the brain. It can be from increased tension in the neck area or from the muscles near the head region. And can also be an imbalance of the vessels, so the blood vessels in the brain. Lifestyle factors can trigger these as well. So your alcohol, caffeine, stress can bring this on. Different foods can trigger them. Inadequate sleep and stress is a big one.
So what are the most common primary headaches?
Yep, the most common ones we see are migraine, cluster headaches, tension headaches, and trigeminal autonomic cephalgia. More uncommon headaches we see are chronic daily headaches, cough-induced headaches, exercise headaches, and sex-induced headaches.
So you mentioned cluster headaches. What exactly is a cluster headache?
Cluster headaches are usually more common in males. What it is a very severe headache. It usually lasts for several days. Some people can have it for weeks. It's generally on one side of the head, usually pinpoint behind the eyes, almost sharp stabbing type of pain. You can get some autonomic or some sweating or like nerve changes that will occur that are kind of odd. So you would sweat on one side of the face, you'd have the stabbing with it, and prolonged type of headache. So pretty severe.
Yeah, and it doesn't sound pleasant. Oh.
It's not. It does not.
So how about a tension headache? What is a tension headache?
Tension headaches are generally caused from tension in the neck area. The muscles are tight in the neck area, and then they'll pull. This can be from not sitting properly at work, so ergonomics at work can cause a headache. The pull on the skull and the brain kind of adjusts the cranial plates in the brain and pull on the posterior of the head. Generally, you feel a band-like sensation, or like a band is wrapping or pushing onto the head, and we generally associate that with the muscles.
And the last common primary headache that you talked about was and I'm not going to try to pronounce this, the TAC.
The TAC, trigeminal autonomic cephalgia.
And what is that?
So we have a trigeminal nerve coming from the brain area that innervates the facial area. And so if those are inflamed or irritated, they can cause pain in the facial area and into the scalp area, which can be kind of just a chronic pain. So it's a specific type of headache that we've found a reason for. So it's subclassified under the primary headaches.
So now you mentioned secondary headaches as another cause. What are secondary headaches?
So secondary headaches, there's some sort of underlying disease state that's causing the head to have pain. or causing the headache. Many diseases can be life-threatening, and so that's why we usually have you come in for any severe headache. These can range from acute sinusitis, blood clot in the brain, carbon monoxide poisoning, concussions, dehydration, ear infections, encephalitis, meningitis, influenza, medication changes, panic disorder, pressure from tight-fitting equipment like a helmet or goggles, or a stroke.
So that is a very, very long list. You mentioned, let's go back to primary headache cause. You mentioned migraines as one of those, and I'm sure most of the viewers have probably either heard of migraines or even had migraines. Tell us a little bit more about what exactly a migraine is. Is it just a headache?
No, so usually migraines are specific. They have maybe an intense throbbing sensation, a pulsating sensation to the head. It can last hours to days, and so that can be different than just a plain headache that goes away on its own. It usually is accompanied by nausea, vomiting. Some people get blurred vision. Some people even have something called an aura before they have a migraine. This would be a sensory warning system. So it's like flashes of light, blind spots in their vision or black spots in their vision. Some people get tingly. Some people get sweaty or sweat on one side of their face.
And migraines are in 4 stages?
Some migraines are in 4 stages. Usually starts with the prodrome. Then they may or may not have an aura stage, those sensory symptoms that I was describing earlier. And then the attack phase is when you actually have the head pain or the headache. And then the postdrome phase, when you're recovering from the headache.
So what causes migraines?
There are a lot of causes or triggers that we find with headaches, but we don't totally understand what causes a migraine. We do know that some of it runs in families, and so there's a genetic component. There's also an environmental component, triggers that usually commonly come before or cause the actual migraine for some people.
And what are some of those common triggers?
Common triggers are female hormone changes, so the regular hormone changes in your menstrual cycle, certain foods, certain drinks like alcohol, wine, caffeine can be an issue. Stress can cause a trigger. Sensory stimuli, so if you're sitting in front of a computer quite often or every day, maybe you're a welder and you have flashes of light that you're exposed to all throughout the day. Changes in sleep pattern can be big. Physical activity, weather changes, and if you've had a change of medication, sometimes that can cause the migraine or the headache.
So when should someone see a healthcare provider like yourself about their headaches?
So a headache can be a symptom of something life-threatening happening. You want to call 911 or go into the emergency room if you've had the worst headache of your life. If you've had a sudden, severe headache, that would be alarming and need to come in for further evaluation. Or if your headache is accompanied by high fever, confusion, paralysis or weakness on one side of the body, if you're having trouble walking or speaking.
So not all headaches are going to cause a trip to the emergency room or calling 911, but I'm assuming that there are certain instances where someone would want to come in and see their primary care provider too.
Sure. So most of us have probably had a migraine in the past. When we want to see you is when it's becoming more frequent for you. Maybe your headaches are more severe than usual. You also, if they're not getting any better with the over-the-counter medications. Also, if it's preventing you from getting to work, you're missing a lot of days of work, you can't sleep, or you're not doing your normal activities. Or in general, if they're just causing you distress and they're very annoying to you, that would be when to come in.
All right, so now the million-dollar question. What are the best ways to treat a headache?
The most effective treatments for most headaches are over-the-counter medications. So your acetaminophen, aspirin, and ibuprofen. In the clinic, depending on what type of headache you're having and the pattern that you're having, we can use antidepressants. We can use hypertension medications are sometimes helpful for the vessel changes. Anti-seizure medications can also be pretty effective, changing the hormone balance in your brain. And for tension headaches, and that's the tight muscles in the neck, back of the neck, we can use Botox, acupuncture, osteopathic manipulation, and chiropractic treatment.
So now you mentioned some alternative medications like antidepressants and the hypertension medications, anti-seizure medications. Why do those work in some cases?
Depends on the mechanism of why you're having the headaches. If there's a hormone imbalance, sometimes increasing your serotonin and norepinephrine in your brain can help actually with the headaches. Your blood pressure medications, if you have rapid changes in the vessels, so expanding and shrinking, that can cause headaches and pain. And so the antihypertensives can be helpful in that respect. Some of the alternative medicines, the manipulation, the chiropractic, the acupuncture, are sometimes just good for stress relief. So maybe those help calm you down in general. They can also help with the structure of your neck and back area, which can be stressed if we're sitting a lot.
And you mentioned Botox as one of most people think of Botox as like a cosmetic surgery or non-surgical procedure, but Botox can be helpful for headaches.
Just like we can use injections of Botox around the eyes and the lips and the mouth to decrease wrinkles, it's really just relaxing the muscle there so that it doesn't cause a wrinkle. So the more you laugh and smile, the more wrinkles you get. But what they can do is they can use Botox on the big muscles in the trapezius area, the rhomboid area, and in the neck area to relax some of the muscles that might be tight in the neck.
And you mentioned osteopathic manipulation. You're an osteopathic doctor. Explain a little bit more about what exactly osteopathic manipulation is.
We are trained in medical school to do manipulation, to do hands-on with musculoskeletal disorders. Chiropractic treatments kind of spun off of our profession. And so we do a lot of things similar to the chiropractors, but we also look at the whole body. It's particularly helpful for tension headaches. Some of us do cranial manipulation, which can be helpful for headaches with those vessel changes and things like that. The autonomics that go through the brain, so the nerves to the brain, can be released as well. Very helpful for headaches. It's worth trying. Doesn't include medication, and maybe you could be on less medication for your headaches.
Let's talk about some ways to prevent headaches from occurring altogether.
Preventing headaches is really just being healthy. Getting adequate sleep, drinking plenty of water, exercising regularly, eating healthy, decreasing your alcohol and your caffeine intake. You could do muscle relaxation techniques, so decreasing the stress in the upper body. Not using tobacco products is helpful. Sometimes an ice pack can be helpful if you're getting a headache. If you feel a headache coming on, getting to a dark room, a quiet room can be helpful to decrease symptoms and make that go away a little bit quicker. And keeping a headache diary can be very helpful, especially to figure out what your triggers are.
What is a headache diary? Is that simply just a journal where you write in instances when you have a headache, or is there more to that?
It's a little bit more than just a diary, but it could just be a diary. It depends on how often your headaches are. You could do a calendar as well. If a trigger is your menstrual cycle, maybe to circle when your menstruation starts and see when your headaches kind of correlate with that. The other triggers you think about is if you're not eating regularly, maybe you would jot that down. And really a date that you had the headache, if you took any medication for that headache, what seems to help with it, what you thought the trigger was for the headache.
And I'm assuming that headache diaries can probably be pretty helpful for providers like yourself, too, when you meet with the patient.
Yes, so they are very helpful if we have all of that information. It's generally what we're trying to gather from you when you come into the office, and so if it's written down, sometimes we can look and see a pattern that maybe you didn't see while you were jotting it down in the journal or the diary.
How about risk factors for headaches? So gender. Are headaches more prevalent in men or women, or does it not matter?
Migraines are more prevalent in women, usually in the younger age groups.
And why is that?
They're not quite sure why. Speculation would be more of the hormone shift in the cycles. We see more depression in women, and so that can induce migraines as well. Stress can be a factor. And how women carry their stress and the types of jobs that they do.
And as far as age, the older you get, the more headaches you get, or is it an equal opportunity ailment?
Sure. We see more of headaches in the younger population, so the 20s to 30s. As you get older, if you've not had migraines in the past, a migraine is something serious to come in to see your provider for, especially over the age of 65.
Because it could be one of those secondary causes that you were talking about?
Absolutely.
Mm-hmm. Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Dr. Jamie Johannes, Mayo Clinic Health System family physician, for joining us today on Speaking of Health. A great topic and a great job. Thank you.
Thank you very much.
Have a great day, everyone, and be healthy.